That's okay.
Good evening, everyone. Welcome to talk about realizing the national empowerment about alternative fortunate our show. Robert Whitaker. Robert is one of the most influential. He's light to even more what is not known. Drugs. And we are now facing. So we are grateful to have to get into a
Great.
great.
And
Great.
a fellow
Right.
better than travel across the world.
To give a introduction to Robert Whitaker, esteemed guest, tell the history of medicine during of the mental magazine, the best of 2000. His newest book is called Anatomy, Psychiatric Astonishment in America. And this one won the Editor's Book Award 2010. And prior to these books, at the Alabama Times Union, and his journalism won several, including the award for writing and Association of for best. In the was named for the Pulitzer Prize at Harvard a time. Thank you so much for being here. Do you want to introduce yourself?
Executive director and recovered from what is schizophrenia. And I'm also a guy. Paying your around bowl of medication. It's just possibly soda. Just had a couple. Well, what do I see as the role of medicine and directly and I emphasize consent. They did not ask me to speak. I'll just honestly, I then am like a psychiatrist who is against. This is the dilemma that
This is the dilemma of our time.
Yeah, especially in the who wants to do it differently. Obviously, excellent outcome studies.
You immediately got to the big topic. You didn't waste any time. And I think that the medications is a piece of care in this country. Really for disorders has built up around, which is that they're absolutely so. Of course, we ended up with this chemical, so that's part of it. I don't. We can get into that. And people, but the whole point is, society is ourselves belief. We have law built around that belief.
Society, big
thing.
Yeah,
it's not just the psychiatric system.
It's not just that. So
medical
may not be necessary. It opens the larger evidence that this is but the research is this. That is fixed chemical. No. When they researchers look have low serotonin before they go on the drug, no. Schizophrenia, of course, have over dopamine drugs, no. So the drug story is it's false. And it was 60s and 70s not to be found to be so. And then with Prozac coming to market in 1987, it was really in two ways. Advice for drugs, and also, frankly, psychiatric association. This image of
We're real doctors. How about that Thomas, the director of mental health, basically admitted.
Yeah, listen, Tommy said, that isn't, it's not true.
Real,
Not true.
biological.
It was a dead end. And you also have the editor-in-chief of Psychiatric Times, a publication, APA, saying chemical and mental disorders was always a myth and be propounded by well-informed psychiatrists. That's they were washing their hands of it. They even said, I don't know from psychiatrists who ever said that. So people against psychiatry was saying to make us look bad.
Oh, well.
What I have to say is that shows the washing because it's been. But
It goes.
You can go on the APA and say that you can see where the fix a chemical. Once you understand the key now that has become public disappears, logical rationale. To turn to long-term studies tell us of.
Yeah.
Now you can it because because a class of drugs we're sure of, right?
That's
we know
what's
that to be
been,
true.
Yeah.
Well, that's what society. But what do you find with long-term outcome studies? It goes back 50 years. That by the end of the 1970s, we what we're more research to in the medicated area, and then they say they actually come up with medication, psychotics, increase psychosis long term.
They increase psychosis that a person can experience.
Yes, and now we have all evidence.
Increase the dopamine.
Exactly. It has to do with reaction to the drug.
Hmm.
But we don't. All I'm going to say drive this and not. And so, long-term study we had schizophrenia outcomes was done in Harrow at Illinois. What did he? He continues, yeah, up to 20 years. The recovery 8 those who and psychotic.
Wait, let's just repeat this a minute.
Yeah.
Yeah, that's quite a staggering
The
figure.
recovery rate for people who got psychotic over recovery rate
8
times.
times.
By their to the community.
Not social. You got to be recovery, working, having
Right.
and they were much likely to be psychotic long term. And here's what you see in Harrow's data we don't see anywhere else. At the end of 2 years, you're not doing anything else who stayed on. There's a little bit better. In Harrow's data, people of the off that gone on.
After
Between
So
2 and 4.5 years.
afterwards, they
See that in the research that you see with this people once they're all we've lost sight of
some races in that group has the
wondering, yeah.
wondering verified by study only it was even more randomized
It was.
control
So
study.
naturalistic study where just followed a bunch of people and then people recently out of the Netherlands where a group of mice have to come off regular maintenance. They found at the end of 2 years a higher relapse rate drug withdrawn group. Relapse maintained without people managed without people going back to the hospital basically. But what happened by group that was tapered down high of a recovery rate, they actually had relapses. So wondering, he says, we've been doing the wrong thing. Looking at term symptom expression, we haven't
Long-term
long-term
recovery.
out-
and recovery and revitalization and
function.
Yeah, we're using this term rehabilitation now,
Okay, that's
even more
good.
than recovery. It feels though in life.
Then that's what you're
It's
finding.
really what we want. The mental
Yeah, so this shows is this thing now. You know what, Harold?
Van Thomas
said-
and Sol-
said, maybe
high authority.
he said we have to consider recovery over time. And that was about 30 years ago.
He also said we're wrong, which is interesting. Saying that everyone remain on medication indefinitely. Maybe we're wrong about that. Yeah. Well, I personally, a case study at one. This is 'cause as you were mentioning time, it was not dissimilar because medication was very interpersonal, Sullivanian. School. Hospital, I said, this medication makes me feel dead.
yeah.
I was on much better in the newer anti. Initiate I couldn't. It really your emotion.
Right.
We've
was
been
nothing
learning. That's what you need. You need emotional expression. Psychiatrist like, well, let's try.
Right.
I was sort of a proponent of that.
Thank goodness.
I had medical school. I just had to restore a deeper. I think it's only medication sort of interfere with in ways with your recovery. It interferes with an integration you need to go through.
And your identity.
Yeah,
You know,
it
if
feels
you've been
terrible.
if you've been on medication for years, then it's who are you?
It's me
Yeah.
as my drug.
Yeah.
You know, back in 2007, they did a study. Everybody's psych, and some drug and some these were schizophrenia patients. Medication, more socially engaged, etc. The patient have gone through these times without a
Right.
drug, and they said, but they said, grateful for the opportunity to go through without having their feelings.
Yeah.
77? That because of that, maybe they were better able to cope with such life stresses, which is what you're saying. But that
Because they learned that
learned they
survival.
Well, you learn not to be afraid. I think a great deal of psychosis is from fear, terror, and if you
I
that
can-
so terrified that they speak. I mean, they call it Tony life. Safe life. That's
Yes.
right. Because I was afraid of unsafe life. Yeah, I was afraid people, had nefarious interacting with me, getting me to do things I didn't want to do. Elaborate. But they really weren't. So I think that the psychiatrist took me to the deepest part, was really the deepest part. And I don't anymore. Sit with
Amazing.
somebody who is in fear, I can just
And you know what it's like, so you can them.
Just,
Yeah.
but our, wow, that very often.
Mhm.
No, allow it, they don't provide the time, they don't provide
Sure.
the
The
space for
15
it.
minutes.
Yeah, now, we can't open dialogue, which in your book, I've gone there, observed it, you've observed it. Finland, use of
Is really important question. Look at this showing that more people recovering. You know,
Right.
you know,
and that's dialogue,
Yeah.
because that
Yeah.
serves as a society that does something different.
Yes.
So open dialogue in Finland, and up there, 1992. I think first of all is you can see they say psychosis
Very
doesn't reside in the brain. It's in the in-between of
Sure.
people. So they say we heal those relationships.
Mhm.
Treat one person, they treat
And
well.
so the Thomas Insel, when I did this to him, said, so in the U.S. right now, they say that these,
Located in the
Person.
person,
it's all in the imbalance.
like you're a car.
And
There's
remarkably, and partly because maybe they're more oriented society, they say
It's not so
Ah.
there that came from Helsinki area to northern Finland.
going on.
Treatment.
Oh, yeah, right, to get that treatment.
they didn't, yeah.
And I think the important thing is they've been doing this for 20 years. Focus on repairing social webs.
Mhm.
They also focus on like a sense of hope, both so they come back and see able to integrate society with thinking about. What would you hopefully not as a
Yes.
broken being, but as a hopeful.
Empower
So that
them.
becomes the focus. So they use it as a crutch, not a cure.
Mhm.
So do initially try to get
Temporary.
not everybody. Actually try to get people through that. Not going on antipsychotics.
Mhm.
They might use a benzodiazepine to help people sleep, restore sleep-wake cycles. And what are
But
their
antipsychotic, 15 to 10%.
Yeah, if you look at
For
if you
break.
look at first going back to 1992, in the 5 years have never been exposed to antipsychotics. Another 13% use them temporarily went off. 20% are on the drug. Now, what are the outcomes with personality and working? So, in other words, sort of schizophrenia or
Right.
psychosis,
Right.
they no longer became.
Mhm.
And if
For
you
the
talk
rest-
to the rest of their lives, and you
Yeah.
talk to them who initiated this program, they said, change psychosis out. We used to have a chronic thing.
Permanent.
Happen.
Mhm.
Now we buy it a epidemic problem that we need to help people.
And there's identified pain.
No.
They say person focus is they don't. And it's interesting you're saying that care than ever. Actually, they don't even say that now.
Maybe that's adding.
Try to go say sort of the mastermind a lot of this. But I said, Yako, well, outcome network. Look at before and after, and everything. It's just evolution. And I'm practicing it actually here in the now. Practice in a way. The person of focus came to me initially. He could have been hospitalized, but I called him a member. Is becoming a healer.
Well,
Now calling his sister who didn't talk to his mother, and now they're actually talking. He said, "We should the rest of my life."
You say the psychotic person, the burden, test or this disrupts social space. seeing other relationships.
Other relationship. The main pressure point. He was taking care of parents, elderly, off other. When he said, you know, I this should be shared, and their conflicts came.
Sure. Right on.
I see that.
It really because we're network. I said initially, it just was immediate parents.
So how do these all of if 1 in 4 of us at least are on drug? I had quite the struggle with thanks to you, thanks to you speaking your books, and thanks to you, Dan, thanks to both of you, I have been down, and I have been becoming so much more of myself that I was growing as a kid to see again. So
I never
it's more
told
than
you
a
to come
blessing.
off, right?
No.
Say response.
Opened a door. So
You had only before. You had only.
take your drugs.
I think this is such a story. Down into this path of mental patient, right?
Right.
With the life implications. The long things you're talking about, this revitalization. They always talk.
Yeah.
Always the
Exactly.
Feels
Exactly.
like, and they say, life. I think.
yeah.
Yeah.
It shows. As we're talking about life.
Right.
And also here's the tragedy is just telling us the possibility you get through crises and everything.
Be healthy than before, more vital
Often
than
that's
before.
the case.
I definitely feel it. My life before, what was called psychosis, there's no question. I had work. I was afraid of losing myself. I was afraid of expressing my emotions.
Which is far.
Yeah, it's a vital part of
Yeah.
it. So
Yeah.
that's why I'm helping this emotional support is to try to as people. But I think we're going to need another. That's another question. How can we continue, or I don't know, continue because I'm not even sure.
Yeah. Well, the
Shift.
one is what is science? Because science actually that it doesn't think. So we can sit here and like ideologue. This is what their own research is, okay? And I think the other shift can people like speaking out. You can hear the voice of those so affected.
You feel more
alive. The day is my day again.
That's
You know,
wonderful.
rather than
you look
Yeah.
different too.
We need that. It's not certain doesn't get as much amplification, but that's what we need.
Right.
Well, that's one reason for the show.
That's great.
We want to just get it further. Because still is captured by which is fits right down the road. There.
On the TV commercials for, yeah.
But I wouldn't do this. And seeing you, I mean,
Oh, thank you. Thank you so much.
We're
Yes.
off. Still on.
Yeah.
So I was curious to know. So you.
I have.
And
gradually tapering down with the person. And it's just, it's a soul that I've known I have. It's in my things that I should be
long were you?
Since 15, so half my life, like, so.
These stories being medicated.
Hard.
But better because of you.
It's
So
optimistic.
thank you so much for being on Whitaker. It's a new, just
Really, I'm glad 'cause I'm alone now.
It'd be a little lonely.
It can be. I say, well, you know, look at Bob. People, it's in,
be a by Robert Whitaker. You know, store right now, and you can also contact the National Government at www.to.org for more information on how to get involved. Thanks for watching.
every.
Yeah.
Yeah, we got it.